Distinguished colleagues, friends, and fellow advocates for healthcare, wherever you are joining us from around the world, a very warm welcome to you. We are gathered here for a truly special moment, the launch of the Nurse's Diary at the Crossroad of Health Care. This global initiative is designed to give voice to the experiences of nurses, to highlight their challenges and innovations, and to bring the world closer to understanding why their stories matter. It is a platform for experiential learning, global dialogue, and the celebration of those who serve tirelessly at the front lines of care. It is only fitting that our very first voice on this platform is one that embodies the heart of nursing and the power of research. Dr. Hamudat Balogun, RN, PhD, is a highly skilled registered nurse and distinguished public health researcher. She brings with her an exceptional blend of clinical expertise, academic depth, and leadership in multidisciplinary research. With a PhD in public health, specializing in epidemiology, health policy, and health promotion, she has committed her life's work to advancing patient-centered care, strengthening health systems, and translating research into action. Her professional journey spans direct patient care, public health practice, and thought leadership. She has worked with individuals and families living with complex conditions, led on innovations in care, and contributed impactful research on the determinants of health. Beyond her publications and professional contributions, she's recognized for her advocacy, her commitment to professional excellence, and her ability to bridge the gap between bedside realities and policy-level solutions. As we begin this new chapter, giving voice to nurses, honoring their resilience, and shaping the future of healthcare, it is my privilege to present to you our opening speaker, Dr. Hamudat Balogun. The floor is yours.
Hello. Good day, everyone. Good evening, good morning, wherever you are joining us from. Of course, my name is Dr. Hamudat Abiodun, and yes, today we are launching something big, something a project very close to my heart, and I'm so happy to be a part of this project. Thank you very much, Feroz, for giving me this platform in order to discuss with other nurses and other healthcare professionals also who would like to join us as we start this wonderful program. Thank you all for joining us, and yes, let's do this. So, why does the voices of the nurses, why does it matter? Yes, we need to be heard. I remember growing up as a child, nurses are seen as a housemaid in the hospital, like a maid in the hospital where you can talk to someone you can talk to anyhow, someone you can that can be disrespected. But this has to change. Nurses are human. Nurses are caregivers. They are that those people between the doctors and the patients. They are very knowledgeable. They dedicate their life, their knowledge into the care of patients and even to the care of their families also. They take care not just the patient but the family. So this platform is not just for me to keep talking. We are going to be getting nurses from different parts of the world to come and share their opinion, to come here and talk to us. We are going to get nurses from Africa, from the United States of America, from Asia, and then we can be able to compare what is happening in Africa and what is happening in Europe. For example, I am a nurse here in Europe, and we can see what are the ways we can help nurses, what are the ways nurses can continue to contribute to the healthcare system. Yeah. So, of course, these are the purpose of this platform to humanize the nursing experience. Let's hear the nurses. Let's hear the voices. Let's hear their stories. Let's talk about their challenges. Let's talk about their wins. Let's talk about their hope, their aspiration, what they desire, what they want, and what they desire, and what they actually need for from the patient and from the nurses. Not just registered nurses this time around, practical nurses, any kind of nurse. This is the platform for us all. And also the student nurse, you are not left behind. Also the retired nurse. Oh my God, they are full of experience. We want to hear from their experience. We want to hear from their long years of service. What has changed? Has it always been the same? Has there been changes over the years? So this is the platform for us to amplify our voice as nurses, and of course to create the global dialogue. Everybody from every part of the world has a platform here. It's not just about the African nurses, it's not just about the European nurses, it's not just about the American nurses. This is all of us coming together to form a united bond. And of course, this will also affect the policy making to the government. The government can hear our voice. There will be research. There will be publications on the findings we do on this platform. So, of course, this is a great platform for nurses and also for everyone to hear our stories. So let's start with my story. My name is, like I said before, my name Hamudat Abiodun. I started not as a nurse. As a young girl, I have so much dreams. I have so many dreams. I started as a nutritionist in Nigeria, and I'm also a registered dietitian in Nigeria. So I started as that. Then I moved to Europe to complete my PhD in public health. As I continue to study to be a doctor of public health, I realized that I am not feeling fulfilled. I have this fear lingering in my heart. What if? What if there is this kind of thing going on? Of course, I was working in the university as a researcher, but every year I have to renew my contract. I have to renew my contract. So I was worried about job security. What if I have to talk and talk and talk, and I have to struggle every year to get a contract to remain in the university? What is going to happen to me? And also, I feel a void in my heart, like I needed more. I needed something. I just knew it. So 2019, I decided I was gonna apply to be a nurse, to go back to school, to start studying to be a nurse. And it was a wonderful experience. It was wonderful. It was tasking. It was tiring because at the same time I was doing my PhD, and at the same time I was doing my nursing degree. Of course, coming from the background of public health, there are some studies in my degree for nursing that I don't have to do anymore because, of course, I have all those knowledge and understanding. But despite that, I will tell you the nurses courses are no joke at all. But of course, I have to be resilient as I am. So I continue to forge ahead in the study, and to the glory of God, I became a registered nurse the same year I got my PhD. And that is why at that point, I felt fulfilled. I've never felt that kind of fulfillment because now I know there is something called job security. I can always find a job. I don't have to talk too much. Everybody know who a nurse is. I'm a registered nurse. I'm so proud of it, and always like, oh, I'm a nurse. It's so easy. But when you tell someone, oh, I'm a doctor, and they're like, oh, I have headache and all stuff like that, like, no, I'm not that kind of doctor. I'm not a medical doctor. I don't have to explain anything when I say I'm a registered nurse, and I am proud of who I am and what I have achieved so far. I have worked in different healthcare facilities because that is one of my goals. I worked in Finland, I work here in Ireland. Don't want to just focus on, oh, I want to be a home care nurse, oh, I want to be working in this particular unit in the hospital, or I became an agency nurse from Finland, and here too in Ireland, I do agency nursing because that gives me the opportunity to see things from different health sectors. I work in the hospitals. I work as a community pediatric nurse where I take care of little children with complex needs. I also work at nursing home where I look after the whole people, and I kind of see like one thing about this nursing profession I found very challenging is the mental health of nurses because so many times we all have our own struggles, our own personal, but you have to go there, put a smile on, and just do your job. And sometimes the family yells at you, the patient yells at you, and you just have to keep calm and forge ahead and provide them the quality care they require. You don't kind of like, okay, because this particular patient has spoken to me roughly, I'm not going to take care of her. You still have to take care of everyone equally. You still have to. I remember I was working at an hospital the other day, and of course, I'm an agency nurse. I just went there that particular day. It's not that I've been in that unit for a long time or something. I just went there on that day, and there was this. Of course, one thing about agency nursing is they give you those patients, the nurses there that already know about all the patients. They give you those patients they don't really like. So I got this patient, and of course, I'm there trying as much as possible to find my way, writing reports, looking at doctor's orders, and doing all that, taking care of, I think, 6 or 7 patients on that day. And every time the nurses are calling me to the nursing station that, oh, I have a call from the family of my patient, and I keep picking this call, and this um, man keep calling to ask about his mom. And I'm telling him, oh, your mom is okay. This is the situation now. Because I don't even know who was calling. So I just picked the call and I'm like, okay, hello. And he introduced himself. I'm so and so person. In my head, I'm still trying to think, who is this particular patient? But of course, I have to be positive. I have to be able to say something to him about his mother that I just met that very morning. And the funny thing was, this particular man keeps calling every 20 minutes because he won't be able to come to see his mom that weekend, and it was a Friday, and he wants me to attend to his mom. assure him his mom is gonna be alive till Monday when he was able to come. So it was kind of like a struggle for me because I have other things I want to do, and every time he's calling my colleagues there, they are calling me to pick this call. So it's kind of like so many times there is a lot going on, and of course you can't yell. As a good nurse, you are not supposed to yell like, "Hey, you just called 20 minutes ago. Can you please?" You just have to keep reassuring the families that okay, this is the situation. Of course, you don't lie. You have to tell them the truth. If the situation is bad, you have to prepare them for it and everything. So that is one of the most challenging period. And also, I remember there was a day then in Finland, I was a nursing student and I was working in the oncology unit. And my supervisor just told me, "Hey, Hamza, let's go. The doctor has something to say to this patient." And I just followed. And we got to the room and I realized they were actually telling the patient that we can't give you any care anymore. And now you just have to go home and we are going to give you all the painkillers we can get and keep you comfortable till the end. Yeah, it was actually, I felt really bad. Like that actually ruined my whole week because I have never been in a situation where they have to tell someone, okay, you are going to die. We can't help you anymore. And being there as a student nurse, and the oncology ward is one ward I have really longed to be in and to work in because I lost my friend to cancer before I started nursing. So, of course, I really want to know what is going on here. So, it really messed me up. But of course, the next morning you still have to just get up and continue your job. So yes, these are some of the things nurses go through every day, and you just have to know how to have a life, and of course, not to allow what you are doing, whatever is you are getting in the hospital or your workplace or the nursing home or the home where you work in the community also, you don't let it get to you or affect you mentally. So having that thing that okay, let's try to of the challenges of being a nurse. I come home sometimes and I'm checking the pulse of my children while they sleep because, of course, in your head you are still trying to like, okay, I hope everything is okay and everything. So yeah, this is my story. This is one of the reasons when Spirot reached out to me about this particular platform where we nurses can actually talk about things like this. It it really, really, really came very close to my heart because I have been there, even though not for, I don't have like 10 years experience, but within the period of time I have been a nurse, I think it has actually changed my life for good. You have appreciate the gift of life, you have appreciate the gift of good health. You realize people don't get sick so many times as a consequences of what they do. Some people actually live a good life. They don't drink, they don't smoke, they don't do anything bad, but yes, they are having this particular sickness that is taking life away from them gradually. So yes, this is my story, and I'm sure there are other nurses out there with so many years of experience who have their stories that need to be heard. And of course, we this is the platform, this is the place where everybody wants to be. And of course, this is also to encourage anyone. My story is to inspire, to encourage anyone that you can be whoever you want to be at any particular point in time. When I decided, yes, I want to complete my PhD, but I want to be a nurse, some of my friends felt, what, are you okay? Is this not you driving backward or something? I said, no, I know what I want to be. And I'm grateful to my mom. As a child, she wanted me, when I was growing up, she said she wanted me to be a nurse. I remember then I'm like, no, mommy, whatever you are saying, I don't want to be a nurse. I don't like the uniform because back then in Nigeria they wear this short dress and this hat they put on their head, and I'm like, oh, I don't know what they call that. they put on their head, and I'm like, no, you can't find me in that gown. I hate the gown. I don't like to show my legs, so I can't be a nurse. All I see is just that uniform. The heart behind it, I can't see because, of course, I'm a young child. I'm just maybe 16, 17. I am a teenager myself, so I'm not saying what she is saying. And I remember even after I completed my master's degree in nutrition and dietetics, she was like, you can still be a nurse tutor. Do you know that? And she wanted that for me. Like, she just wants me in the nursing environment. And I really thank God for her. And I thank God that today I am everything she wanted me to be. I'm a nurse, I'm a lecturer, I'm a nurse tutor, I teach nurses also. So, yes, this is an inspiration for everyone that you can be whoever. Don't let age or stop looking at the barriers like, oh, this is the time I have to stay home with my children. I have to feed my children. I have four. I have to feed them into what I want to be. I'm not going to give up my career just because of my child. I'm not saying women shouldn't put a pause if you want, but don't let it be a barrier. Don't let your children be a barrier, or don't let, oh, the family life be a barrier for you not to achieve what you want to achieve. While I was doing my nursing and I'm having my PhD, I have three kids and I was pregnant with the fourth. But I don't have that determination that, yes, this is possible. Anything is possible if you put your mind to it. And the nursing profession, we still need people. We need people every day. There are needs for nurses. So you can still, if you are a student listening to this, I'm telling you, yes, there is still room for you. It is not a saturated field already. No, there are different aspects of nurses that every day. I think every aspect of nurses also there is space for it. There is availability of jobs for you. So yes, this is my story, and I look forward to hearing stories also from other nurses who would like to join us on this platform every fortnight to discuss how tell us your stories and yeah, inspire us because of course every story there is always a lesson. There is always a lesson, something for you to learn in the lesson. Next slide, please. So, what are we doing? Let's go back. What are we doing next? Yes, let's talk about the burnout and the mental health. Oh my God, let's talk about the night shift. How do you balance out? We are going to be talking to nurses, how they cope with this pressure, where they have to do night shift. Sometimes some nurses do, well, I think in Ireland, most nurses do 12-hour shifts. In Finland, we do 8 hours, but sometimes you have to do more if there is lack, if there is need for it, you can do long hours. But here in Ireland is mainly 12 hours 12 hours work. So of course there is the burnout and there is the mental health. I have already talked about this. Also, let's talk about the innovation in practices. When there was scarcity, of course, we remember the COVID era. I'm one of the COVID nurses. I started my nursing degree while COVID was still a thing. We always use the mask. I remember I never know what my classmates looks like for a very long time because we are always wearing the mask, even in class and everything. We only see each other through Zoom then. So yes, what do we do if there is no PPE? What do we do? We are going to talk about this also coming up. These are some of the things we'll be talking about. And also the Global South voice next year from our nurses in Mumbai. Yeah, I'm really looking forward to this. Let's talk to the male nurses. Of course, I remember my students were telling me about how they feel being a male nurse and how so many people don't want, some female patients don't want to be touched by the male. And also some male patients prefer to be touched by the female and not the male. So let's hear what are the challenges, the leadership and growth and the rising of rank of male from the male nurses perspective. They also have interesting story, believe me. Then let's reflect and look at the future. 2025 is just 4 months next in 2025. We have to see what, let's look back at 2025 and see what, how far. 2025 for me has been a year of so many things. Like, of course, I moved to Ireland in 2025. I started teaching in the university 2025. So yes, let's look at how 2025 has been, and what do we have in the future. So this is how the um, program is gonna go. It's gonna be bi-weekly. Sometimes it's just gonna be vlog night, maybe when we are able to get live coverage of the stories of nurses, maybe while at work. So sometimes it's gonna be a mix of live talk, some voiceover stories, and the field report also. Also, there will be, of course, guests and question and answers. You can ask questions. We are all here to answer your questions. We'll be here to keep it real. We'll be here to let it all out. Let it all out. So yes, there will be interactive sessions where you can talk to our guests from all over the world. Just stay tuned as we bring so much fun, so much lessons to learn, so much stories, and sometimes there might be tears, believe me. Yeah. So yeah. So these are some of the things that are coming on the next episode. Please stay tuned. I would like to see everyone and even more people joining this platform every 2 weeks, bi-weekly. Yeah. And then, how do you help us? How do you encourage this? How do you keep us coming back? How do you keep us coming back every fortnight? Submit your stories. I'm gonna leave a link for the WhatsApp number in the comment section. There will be the WhatsApp number, the Google form where you can actually fill and say, hey, I would like to be here. You can join us on different social media. We are on Instagram, we'll be on TikTok. You can join us, and of course, use the hashtag Nurses Diary, Global Nurse Voices, and you can see and you can contribute. You can make comments. You can nominate nurses. Tell us about your colleague you want us to bring here. We'll reach out. We don't mind. We are gonna reach out to nurses who you find interesting, who they have something to share, who are not shy to share their stories. Yes, we'll be here to listen to. And of course, you can participate in the monthly Nurses Lodge webinar. Yeah, that is gonna be an interesting platform also, where nurses, we just chill, relax, and we have this webinar where we also, every time there is something to learn. Every time there is something to learn. Yeah, and of course, there is the nomination for the colleague of Voice of Courage recognition, where you can nominate your colleague who oh, this person has shown courage. Tell us a little bit about what this person has done and why you think the person should be the Voice of Courage recognition. Yes, these are more is what will be happening on this platform. I'm really grateful for everyone that has been able to join us today. I'm grateful. I hope to see you next time. Yes, the WhatsApp number will be shared. The WhatsApp number will be shared. Yes, on the comment section. Yes, you will see the WhatsApp number, and also I think there will be an email. Yes, there will be an email also in the comment section where you can actually reach out to us. So yes, we are here, and we hope to be here every time, every fortnight. We hope to be here. Um, we hope to be here every time. And next time, this is what we'll be talking about. We dive into the night shift, the family, and having faith. Sometimes it is not all about the care. The faith also, you have to be strong for your patient. You have to believe, have faith that everything is gonna be all right. The medication, the care plan is gonna work for this particular patient. And yes, these are more is what you are gonna be experiencing on this platform. And I'm just so super happy to be your host. I will be the host of this, and I'm so happy about this. So I hope to see you. And if you have any more questions, we are willing to answer the question. And of course, reach out through email. The email address is there, amudat.phd@rw. Yes, our research center headquarters is in Rwanda. So yes, thank you so much, everyone. Thank you for joining. My friends that took the time, they have been on my neck. Thank you. I see you all. Thank you so much. My colleagues, thank you. Thank you. It's really nice working with you. My family, wow. Without you guys, I can't be here. Firot, kudos to you. Thank you for reaching out. Sometimes some of us are so quiet, we don't know what to say, we don't know what to do. But the push from Professor Adedeji and Dr. Kudrot, it has been so amazing. Thank you, thank you, thank you, thank you all. See you next time.
Thank you.
Bye.
Bye.
Thank you.
Thank you.
Bye.